Why don't you introduce yourself?
Sure. I'm Marge Mayerson from PwC, and I'm the Managing Director of National Benefits, so I've got responsibility for the health and welfare plans in the U.S.
So, as you can see from the title of the slide, we're talking here about financial wellness within the context of HSAs and how an employee population can optimize their engagement with the HSA. We have a little tech today, so I'm gonna call out to our audio and visual folks to just advance the slide as we go through. So if you could advance to the next slide. Little background information about HealthEquity. We oversee about 2.1 million health savings accounts that we administer. We went public about 18 months ago, so that was a nice stress to add to our lives. But the purpose of it was to expand our resource capabilities. We're growing at about 50% a year. Industry-wide is growing about 25%. So, we take this very seriously. This is at the heart of what we do. We integrate with 80 different health plans. Oftentimes I'm asked, what does that really mean? It means this. We're willing to integrate with a health plan and gather, eligibility and claims information from them, a file, so that we can have that information already housed within our portal. Because as you'll see later in the presentation, if you don't make health savings account easy for employees, we all know this, easy for them to deposit money and spend money, then there's no way they can advance beyond viewing the account as just a spending account, much like an FSA. And so those integrations are extremely valuable to us. And it's also valuable for us to be able to integrate with other elements of your engagement framework. We all used to use the word ecosystem, but let's all agree that's overused. So let's call it engagement framework, where we can also work with telemedicine, telehealth, other vendors that make up your health engagement framework, so that we can message and educate and engage the employee population towards moving beyond, beyond the HSA being viewed as solely a health spending account. We have $3.7 billion. If you added up all the HSAs, what the balances are. What's nice about that assets under management figure is that tells you that people they do have money in the accounts, and they're slowly trickling accumulation in those accounts. The question that Marjorie and I are here to answer is, can we get our employee population who have high deductible health plans with HSA to view the HSA as more than just a medical spending account? And the answer is yes, we can, and we're going to share that with you today. And then lastly, we do all other health accounts as well, HRA, FSA. We're a non-bank custodian in our space, which for your purposes simply means that we can do a lot of the things that a bank can do, but we can extend beyond that with things like 24/7 service, which is obviously not typical of banking hours. 32,000 employers we work with, and going public, what's nice about that is you now have transparency and visibility into the financial strength of our organization. Next slide, please. This slide, I have a tendency, I've been told, to often say, this is my favorite or this is the most important slide. And I'm not going to do that today, though I just already did. So this slide's important because I want to frame for you a new way of looking at the HSA. Look at the HSA really is the totality of these levels of engagement right here. And at the base of this, what technically is an inverted trapezoid, you'll notice to the left side, running up and down, it says education and engagement. And on the right side, it says contributions and balances. So as you see this expand, as people get more education and engagement, and that includes obviously self-service web tools, messaging, webinars, all the typical attendant methods of engagement we use, as they move up this continuum of engagement, they put more money in. Not rocket science, I know, but the question we want to answer is, how do you get them to move along this continuum and advance their engagement of the HSA towards optimization? Before I get into each of these segments briefly, I do want to quote Dr. Steve Neeleman, who is one of the founders of HealthEquity, practicing ER surgeon up until a year ago. And he said, we build health savings for life by meeting every member where they are, and then through education and engagement, guide their journey to optimize the HSA. And what I'm suggesting to you is that the journey to optimize the HSA is on this slide. It's right here. So let's start with spender. We all know what this is about. when your employee population looks at the HSA, their first impression, particularly if you've just transitioned from an FSA environment, is to look at it as just another spending account. And all they care about is deposit and spend and, of course, tax savings. And so let's call that the blocking and tackling of our industry, right? HSAs, is this spender experience. And the things we've tried to do organizationally as a company, and today's not about health equity, it's about the industry and the idea that through engagement like we've had with PwC, from whom we've learned a lot, that we've now leveraged and deployed in behalf of other of our clients, that through engagement and collaboration, you actually can move the needle on your population becoming more than just spenders of an HSA. So that first experience here, let's all agree that the lion's share of your employee population is there. Let's also agree that 5 years from now, probably a lion's share will stay there. There are some folks who would define an optimized HSA as long as I can swipe that card, it's optimized for me. Okay, I get it. The real question is, what if there's a segment of that spender group that actually would not stay in spender if the path was lit some other way? In other words, if there's a clear path that could advance them beyond the spender, we contend that there's a segment that would definitely do that if the rails are there for them to do it. So that second informed consumer, what really is that? I always joke that that's the simple understanding, and it's a simple understanding that whatever I don't spend on medical today out of this account, I get to spend on medical tomorrow out of this account. And that sounds silly, but you have no idea how many open enrollments I go to where somebody comes to me and says, you know, Mr. Humphrey, I was really interested in the discussion of investing the HSA, but I have a simple question for you. Why would I undertake the risk of investment if I have to spend this money before the year ends? And of course, that's an FSA. So I'll say, well, look, the S in that is spending, so I hear you, but this is an HSA, and the S in this is saving. And the light bulb really does go off. Let's not blame each other yet, but we're always having open enrollments, we're providing education, we're sending them emails, they come to meetings like this, they spend it all on their iPhone or their iPad, and then they say, oh, I didn't know this rolled over. So that's important. That informed consumer section, by the way, is beyond just knowing that whatever I don't spend today, I get to spend tomorrow. It's another step, which is, if I make more conscientious decisions about my consumption of healthcare, and if the engagement framework of, in this case, let's say the web portal from HealthEquity could plug in and bring in all these other benefits I have from my PBM to telemedicine to wellness program, then I'm weaponized to actually find out if an MRI at one clinic is $241 less than MRI at another clinic. And by the way, that's a real story. I had knee surgery December 21st. Physician told me to go to a clinic to get an MRI. I got on the internet, and within 10 minutes, I found a place that could do it for $241 left. Now, I'll be honest, I was worried whether it'd be in a garage somewhere, and it was a microwave oven attached to a tube, But no, it was a clinic, and they were wonderful, and that $241 that I saved became $241 I could think about for another day. And so helping an employee population capture that vision is what being an informed consumer is. Then the next step is, now that I know I'm making better healthcare decisions and there's money left over for another day, what do I do with it between now and the other day? And another day may be 30 years, 20 years, 12 years, 12 weeks, 2 weeks, who knows? But that is to become a saver. I'm going to share data with you a little later, as will Marge, that shows you that the hallmark attribute of a saver, the number one attribute, is that they invest. They actually begin to treat this account much like you would for a 401k for your health, let's say, or an IRA plan for your health. So this, what you're looking at here, is our way of saying, and I'm saying this not just as a representative of HealthEquity, I'm saying it as a representative of the industry, health savings account industry. This is really what the standard we should be held to, which is, can we graduate members of your employee population throughout this continuum? Because I think we've all worked with people long enough to know that most will stay in spender, right? I mean, that's just reality. But if there's a segment that's staying in spender because they have nowhere to go and they don't know where to go, that's a different issue. It's still incumbent upon us to empower them the best we can. So next slide, please. Employers are always asking us, how do we get these employees to view this as more than a medical spending account? And again, I'm going to contend to you today that there's several steps you can take and that we as an industry can take to help that happen. Next slide, please. This is from Devenir. And Devenir is a wonderful organization. They produce industry data every year. And here's their data about investing. So that first bullet that you see, it indicates that of all the HSA accounts that exist out there, 3% of accounts invest. That of all the HSA dollars out there, which at the time this was taken was around $27 billion, that 13% of that $27 billion was in investment. So another way to view it is 13% of HSA invested assets are in the hands of 3% of the account holders. And look, if you're looking to democratize this as this amazing, and Wall Street Journal published an article just several weeks ago, and the article essentially declared the HSA as the most valuable, flexible, tax-advantaged account in America. And yet, as I say that to you, you're looking at 3% of accounts. How do we change that? That's what we want to talk about today. Notice the shift in 2015. Are there more HSAs in 2015 than in 2014? No question there is. Then why is it only 3% of accounts a year later invest, though, impressively, it went from 13% of assets to 20%? Clearly the message is getting out there, but my biggest worry is that message is resonating more with the already converted. They're probably throwing more at it. Whereas we need to broaden this so that we can really get your employee population to see this as more than that. So, next slide, please. Why are so few investing? I'll tell you, and I have to do a time check here just to make sure I'm tracking. Okay. There's two elements to it. There's a consumer side and there's an administrator custodial side. So there's a side that's the people's, and there's a side that's us as custodians and vendors, right, in this space. Let's talk about people. I already gave you that joke, which was the person who said to me, why would I invest if I have to spend the money by the end of the year? So this FSA, HSA transition is something, it's an education gap. But there are two other issues. That second bullet is that the experience of investing is separated from the experience of cash, typically. So think for a minute about an HSA. And I'll do this as proportional, right? So most of the experience is cash, and let's call this much investment based on the stats I showed you. Well, what's interesting as a custodian in this space is the cash side, for us as custodians to operate, really just requires custodial adherence. It's not near as onerous as the investment side, which requires fiduciary governance. And any of you who work with 401ks know, that's the other bad word, right? Fiduciary. So here's what happens. In the HSA space, there's this tendency, sorry, I keep hitting this. There's this tendency in the HSA space to outsource the investment side to some outside party because you don't want to deal with fiduciary as a custodian, so you outsource it. Okay? When you outsource that, a couple things have just happened. You've also separated the actual portal web experience of the cash from the investments. So there's the first speed bump. And we all know, because we're in the business of people, that getting people to do what's in their best interest, as a friend of mine who's in HR for a Fortune 50 company once described it, it's like herding blindfolded cats. Okay? It's very difficult. So if you have any barriers you create, even minuscule barriers like that separation of portal, where it's a different portal to invest in, that's a problem. Next issue is that they need advice. They need help. I must tell you, we get a lot of phone calls at HealthEquity with people saying, look, I'm 37, I'm married, I have 2 children. I understand I can invest now. Can you just tell me what to do? What's really interesting is Fidelity had shown that the average 401k balance nowadays is around $110,000, and the average HSA balance is around $8,000 or $9,000. But what's interesting is people are far more nervous about investing in HSA than a 401k. And why is that? Because a 401k is indigenously long-term, and because of that, people kind of have a set it and forget it mentality. Whereas the HSA, which could be treated long-term, but tomorrow I might get a bill, creates this variant time horizon that makes people nervous. So even though, don't be fooled by the small balances, a lot of folks aren't investing because they're just not getting the help they're looking for to make those decisions, right? On the custodial side, very similar issues, but let me pivot on how you should look at them slightly differently. Because remember, if I'm an HSA custodian, and I have cash and I have investments, and I outsource the investments to an outside party, and that becomes another portal and another experience, The other thing I've outsourced is any revenue to be made from the investments. Because whatever party I've engaged to now act in that fiduciary capacity, that's the money they keep for being fiduciaries. So therefore, you call an HSA administrator and say, I have an interest in investing. It's not something that is really within their wheelhouse unless it's something they're engaged with internally. What I mean by that is insourcing the fiduciary governance. And then the last thought I would give you is that this non-integrated user experience between cash and investments, that's something that we as an industry have to get better at. Even if you get them to work together, what you need to do is make it feel like a 401k experience, where someone's going in and they have a list of funds and they can sort and do research. And so, next slide, please. Marge, you're up.
It's my turn. Next slide. So when you think about healthcare and you think about healthcare in the future, and you think about retirement accounts and the cost of healthcare in the future, the concept that for a couple from the age of 65 on is going to need $245,000 to cover their uncovered medical expenses, that's sort of a mind-boggling number, because many people don't have that kind of money in their 401k account. So the idea that now they're going to need to spend all of their retirement savings on their healthcare needs is something that's really scary. So from an education perspective, to get people to first of all understand that they need to start building a nest egg for medical expenses in retirement, that's the first thing. But then the second piece of it is, well, how are you going to pay for it, and what's the most tax effective way to save for it? And I think that one of the really important things is to understand the tax advantage savings of a 401k plan, and I mean of an HSA plan, and we call it the trifecta of tax savings. The fact that the money can come out of your paycheck on a tax deferred basis, the revenue that accumulates on investment is also tax deferred, but yet when you actually withdraw the money, it's tax-free if you use it to pay for medical expenses. So rather than needing $350,000 that's going to be taxed, if you save the money in a health savings account, you only need $245,000. That's a huge difference when you start thinking about savings in the future. So if I could have the next slide, please. I probably should have started with this. So I'm from PricewaterhouseCoopers. We call ourselves PwC now because it was too long a name. But we are a professional services firm, public accounting firm, provide consulting and tax services. We are about 42,000 staff in the United States. We have 3,000 partners. We are a private partnership. We have about 3,000 retirees. Many of you may know us from the Oscars. If you watched the Oscars, you saw our two partners that came out, and then they also showed you the little kids. That was supposed to be a funny joke. I don't think it really worked, but but we remember it, right? So
yeah, humor's not their thing, but nevertheless.
So in any event, that's who we are, PwC. So when you talk about professional services firm, when you talk about tax savings, you would think that the minute we mention tax savings, that 100% of our people would be, give me the high deductible plan, give me the health savings account. But it didn't actually work that way. It's taken us quite a while to continue educating people. So we have 3 different medical plan options. One is a high deductible plan, and it's the highest deductible allowable under a health savings account. So for a family, it's $6,650. So if you're going to participate in that plan, you definitely want to fund your HSA. We have a middle deductible plan, which is sort of the middle of the road. It's half of the high deductible plan. And then we have a traditional open access plan, copay plan with minimal deductibles. So we have 60% participation in our consumer-directed health plans. One of the ways that we got there is in our pricing. So our participant contributions are based upon the cost of the middle deductible plan. If you participate in the open access plan, you're essentially, and we say this to people all the time, and we give them examples, and we explain that if you were to take the difference in the premium between the open access plan and the high deductible plan, and you were to put that money into your health savings account, you actually would have enough money to pay the deductible in a tax advantage way. And if you don't spend that money, then at the end of the year, you have money left in your account. Whereas if you sign up for the traditional copay type plan, the money's gone forever. Even if you've never gone to the doctor, you've spent all of this money. And the differential is almost the cost of the deductible for a family. So that's a lot of money that you could be putting into an HSA and maybe not spending. So it's finally started to click with our people, and money talks. You know, people, they'll look at the less expensive plan and they'll go there. We do have retirees, so we allow them to stay in the HSA until they reach age 65, and then we switch them over into the traditional plan. And one thing is that we're sort of a paternalistic organization to our partners. We can tell the partners what to do, even though they don't necessarily listen to us. We think we can tell them what to do. And when we can't tell them what to do, we kind of make it so that they have to do the right thing. So we eliminated the traditional plan for the partners. They only have an opportunity to participate in high deductible plans because at the partner level, we truly believe that they should be taking the maximum advantage of every tax-effective savings vehicle that they can get their hands on. And that's why it makes sense for them to participate in the consumer-directed plans. So how did we get to 60% participation? Well,
Next slide, please.
next slide, please. Thank you. Well, the first thing that we did, obviously, was we told the partners that they couldn't participate in the traditional plans. So that helped them to become proponents of the high deductible plan, and they do actually talk about it with their employees. And we have some very vocal people who have, through participation in the plans, have started to accumulate balances, and they will say to the newer people, you know, it really works. I didn't use the money in my health savings account, and I'm starting to accumulate a balance. So it's been a process over time. We do a lot of education. We do webcasts. We do annual enrollment meetings, health fairs, although fewer of our offices actually participate in those health fairs than we would like. But in years where we make major changes, we get a lot more participation. We also recently have started doing these little videos they're like 5 to 10 minutes long, and you can text a number and then it'll send back the video to your phone so that people can watch their annual enrollment videos on their iPhone, their iPad, or their computer. And it's really good for family members, so rather than having to mail materials, they can just watch a little video, and they're cute little videos. They're very much outside of our normal traditional style. I had to really fight for that. But the other thing that we've got with HealthEquity, I did say we are a public accounting firm. We do have very severe restrictions in terms of independence, where our people can invest their money. So we've used a subset of our 401k as the investment options that are available. It's broad asset classes. There are about 10 investment choices. We definitely use the best revenue sharing, the best revenue share class, so that we have lower fund ratios and we don't have 12B1 fees. So we've gotten rid of all of those extra costs so that investing through the HSA is an attractive investment option, because you can't replicate these types of investment experiences on the open market as a private investor unless you have a lot of money. So from communications, I talked about this a bit. We do have custom brochures. We mail to people as soon as they sign up in the consumer-directed plan. HealthEquity sends out mailings. We have single sign-on into the HealthEquity portal. So when you talk about barriers, you don't have to remember a separate password in order to get to the HealthEquity portal. It's right from your computer, which I think is very, very, very helpful. And we do talk about it as a 401k plan for your health. Could I have the next slide, please? I think I've talked a little bit about the education. We do take advantage of the Education Center on the HealthEquity portal, as well as our own internal education resources. And then when HealthEquity introduced the Advisor web tool, that was something that we were very excited about, because as Danny said, people are always looking for, how do I invest my money? So the great thing about the advisor tool is that you answer 3, maybe 4 very simple questions. It helps you to determine your risk profile and your time horizon. And as the result of that, you then have the advisor tool that will help you to determine an asset allocation. And we make it easy. Once it says this is the asset allocation, you just push a button and it takes care of everything. You don't have to try to figure out, how do I transfer this, how much do I transfer in order to get to these percentages? It does it for you. And then you get weekly, monthly updates. I get emails that tell me how my portfolio is doing, and it gives you a little grade on your, nobody likes to get a B or a C, so they go back and they play around with it a little bit, because everybody wants a portfolio that's rated an A. You don't really think about who's rating it, but you want that A. So it's a great tool, and PwC, we decided that we wanted to pay for this. We didn't want investment advice to have a cost to it so that it would be a hurdle. And I think that was a really wise decision, because it's really helped us to increase the volume of people that are participating. Could I have the next slide, please? So let's look a little bit about our investing behavior. When you look at the total amount of money that's put into the 401k, I keep thinking, see, 401k.
They go together. They go together.
So when you look at the total amount of money in the HSA, 73% of the investments under management are invested
in mutual funds.
They're in the funds. So
I want you to contrast that to the 3% sort of industry, right? Now, I know what you're thinking. Well, this is PwC. I would expect them to. I hear you, but I'm just telling you, even these populations you would consider indigenously, inherently smart about taxes and so forth, like Marge said earlier, you still have to poke and prod and nudge to get them to do things.
And just one other point. I mean, you say PwC, but the average age of our employee population is 30. So it's a young population. It's a little bit different profile, but we're still getting those younger adults to buy into this philosophy that they should be taking control of their health and ownership of their health care, and the assets surrounding it. So of the 73%, 58% of the people who are actually eligible to invest, so that means that they have a balance of at least $1,500 in their health savings account. 26% of that 58% are using the advisor tool. So it is a tool that people take advantage of. Now the numbers at the bottom are a little bit tricky to understand, but when you think about your average investor's contributions versus the people who are not investing, the people who are investing are contributing 207% more than the people who are not investing. And the balance of the people who are investing is 440% more than people who do not invest. So once you get people into the mindset that investing makes sense, they not only contribute more to their HSA, but they have higher HSA balances. So just a little tidbit of a thought process.
Next slide, please.
Next slide, please. When you think about how much the money that you have available to invest in employer-type accounts, obviously the first thing that you're going to want to do is contribute to your 401k to get the maximum employer match that you can get, because that's free money. And it's usually a pretty good return on investment. Most employers match at least a 25% return. After that, if you have some additional money, what really makes sense is to put it into your health savings account. Once you've maximized the amount that you can contribute to your health savings account, then you can go back to the 401k plan and put the remaining money that you can invest into the 401k plan in terms of maximizing your tax advantage savings in your 401k. And then last but not least, when you're thinking about saving for retirement, IRAs, if you're eligible to contribute to them, would be the last place.
Again, I want to just emphasize one important thing, because these numbers do mind boggle. And I will be candid and tell you that across the book of business at HealthEquity, what PwC has managed to do is extraordinary. But what's been important for us is the learning, the validated learning we've achieved in working with them, because they've taught us some things. We've been collaborating. If you're in manufacturing and you have an employee population where only 1% participate in investing their HSA, then getting them to 3 is a win. And getting a population from 3 to 6 is a win, because this is a process. It takes time. Next slide, please. We went to Google in 2014, and we asked them this question. Hey, Google, are you happy with, kind of what's happening with the HSA? And Google said, actually, we're just a touch disappointed, more than a touch, because we had an expectation that our population, which are some of the smartest people, and their average age is 15, is that that they're not engaging this as an investing, as a companion accumulation account to the 401k we offer. So we said to them, well, let's get together and figure out, let's launch a test for 6 months. So we did. One of the first things, rename the plan. Instead of it being just the HSA, it was renamed the Health Investment Plan. Their acronym at Google is GHIP, which even on its own sounds kind of cool, okay? And so we approached them in September of 2014 and deployed a 6-month campaign of education and engagement. Here's what happened. That first line there, they were at 9% of their HSA accounts, so the percentage of all their accounts that were investing, and it went up to 25, and the industry number you see there is 3. In terms of the amount of money, it went from 18 to 36%. You see industries at 21. Now, let's say that the 18 had stayed at 18, but they had gone, let's say that the percentage of accounts had stayed at 9 instead of going to 25. But they went from 18 to 36. That to me is kind of what's happening industry-wide, is where the already converted just decided to put more money at it. What's nice about this is we were showing that new converts were joining. New converts were coming on board. The thing that's interesting about this is then when you surveyed that population and you asked them, how satisfied are you with your HSA experience? What was stunning is the investor group, hands down the happiest of the group. Their contributions went up. Their balances were larger. Their levels of satisfaction were the highest. They, in terms of engagement with the account, online, looking at it, being more involved with it, Gartner Group published some data a year or so ago about the online financial accounts we engage with the most in our lives. And the number one winner will not surprise you. It's bank accounts. Okay, bank accounts. But right up there in the top 3 were health accounts. HRA, FSA, HSA, because, again, these accounts require action. They require activity, involvement. And so one of the things that I put down here where it says consumerism to be determined, we're trying to find out if the investor is truly a more conscientious consumer healthcare. Are they going to minute clinics instead of ER? Are they staying in network? Are they using generic brands? Are they leveraging all the health and wellness incentives being provided, more so than their non-investing counterparts? And I will tell you, as a father of 6 children, I'm sort of statistically predisposed to medical peril, right? And these 2 youngest boys are going to kill me. They just are. And so when I first got on an HSA years ago, almost 4 years ago, that's the first time I'd ever had an HSA working for HealthEquity. I'm one of these folks that had the audacity to go to HR and say, hey, do you have anything else but a high deductible health plan with an HSA? I mean, I'm embarrassed to say it because they did say to me, now, you do know that we're in the HSA business, right? So I was embarrassed by that. But here's the facts, Years later, I actually got the family to buy into this understanding that whatever we don't spend on medical today, we get to spend on medical tomorrow. In fact, my kids understand that at 65, an HSA can be spent on non-medical. You just have to pay tax on that. And they actually view themselves as the non-medical, right? So all of our incentives are now aligned, okay? This Google study, what's amazing about this 6-month experiment and what it did is we back-tested how they had been tracking the prior 5 years. And let's admit, if you're in an HSA for 5 years, your company's becoming mature in the experience. I mean, just 5 years. PwC is unique. They're a decade into it. And so we back tested and discovered that they would have achieved these kind of figures in another 3 or 4 years. So we managed to cram 3 or 4 years into a 6-month campaign, and it worked. Next slide, please. This slide can be very confusing, so bear with me. I want to make it easy. The left column is the how much more an investor contributes to their HSA than their non-investing counterparts from 2012. So in 2012, we asked ourselves this question: do we observe any behavior that's different amongst the investing population than the population we have that has enough to invest but chooses not to invest? And in 2012, we discovered that the investor HSA contributes 38% more than their non-investing counterparts. By the way, let me disclose, that excludes employer contribution, match, seed money, any of that. This is truly their own out of the palm of their hand money. They put in 38% more. Their balances were 171% larger. But look at the $6. One of the things we were doing, we were hypothesizing, which is a fancy word for guess. We guessed that I wonder if the investor actually is not even using it for medical. Maybe they're suppressing their use of the account for medical in order to treat it like an IRA or a 401k for your health. But the data shows otherwise. Literally, the spend difference between the investing HSA and the eligible non-investing was $6 difference. Statistically insignificant, to be honest with you, because one group was spending about $2,100 a year, and the other group $2,106 a year on medical. So what the real difference told us is, and by the way, sometimes people misunderstand that 171% balance as, oh, that's because they did so well in the investment markets. No. I mean, we all know 2015's been tough. It's because they're putting more money at it. They put more in. And we contend that happens because they've made this behavioral pivot where they suddenly now view this account as looking and smelling and tasting and feeling a lot like the other accounts that make up their lives for accumulation. IRAs, 401ks, 403bs. Look at 2015, the bottom row. They're now at 81% contribution over their non-investing counterparts. 187% larger balances, about an $8 spend difference. Again, I declare that as statistically insignificant. Okay? What is the purpose of this? It's to help you understand something interesting. At HealthEquity, 21% of our population invest. Right? Compare that to the industry 3. Right? 21%. I know that Marge's numbers, they were out of the galaxy. But if you just look across the real universe, we're at 7 times industry average because you have to take a very, very proactive stance on engagement and education. And here's a perfect example. We have a 24/7 call center, and we are not measured on how quickly we can get them off the phone. That's not a measure. The measure is education points. So in our software programs, someone will pull up on the system who's called in, and you can see they have enough money to invest. Let me educate them that that's one of their options. That is an important piece of the discussion, particularly in March and April, when we have that wonderful April 15th day coming, where we can then message about additional tax savings that's available to them. So it's an education-based approach as opposed to let's get them off the phone, so we can get to the next person. By the way, I often get asked this question: do you make more money on investments than on when they have their money in cash? That's a wonderful question to ask. And the answer is no, we don't. We make more money when their money stays in cash. So your question then might be, then why over-promote the investment stuff? Well, I'm going to show you from a data perspective. This shows you they put more money in when they see this account differently. And they don't throw it all in investments, not at all. No, they'll put some in investments, but now they start to put more in because they realize if I make informed consumer decisions and I save money that can be spent another day on medical, now I need to figure out what to do with that money so I can optimize its growth. Next slide, please. So I was asked this question, and actually was asked, seeing how Willis Towers Watson, I see them everywhere today. This is a Willis Towers Watson discussion, where I was asked, how long does it take can you estimate how long it takes someone to go from spender, in that little trapezoid, all the way to saver? And I said, from our data, it looks like it's 5 years or more. It takes a while. There's got to be a couple years where someone spends every penny in the HSA in year 1 and year 2, and then complains, why do I have this when I'm just going to spend? And then someone says, well, are you max funding it? And they're only funding it to whatever degree they want to spend, right? So max funding is important. So we were asked the question, tell me what a 5-year-old HSA looks like. at your organization. This is what a 5-year-old HSA looks like. The average balance of all our 5-year-old plus HSAs is $4,431. However, if you then ask the question, well, can you delineate between what you would call the investor HSA and the cash HSA? The cash HSA decides, I don't want anything to do with investment. The investor HSA invests something, a penny or more. The cash balance average for cash-only HSAs is $1,802. I don't think that surprises anyone in this room. But the real shocker is the one to the right of that. $18,000 is the average on the investor side. And by the way, it's not all invested. $5,200 of that is actually in cash, obviously for medical need and necessity. The rest is actually put into mutual funds. So I go back to this idea that the Wall Street Journal declared this and look, I'm not saying they're the be-all and end-all of the world, but it was interesting to see how they wrote the article, because the way they wrote the article basically said, hey, yes, it'll take $245,000, that slide Marge shared with you. How many of us are going to accumulate $245,000 in HSA, right? You look at your employee population, I mean, is it doable? Yes, but profoundly doable? No. Here's what I need you to recognize, that 20,000 in an HSA is better than zero. 37,000 is better than zero. 5,000 is better than zero. And when Marge showed you how to interact the two accounts, I mean, I go to meetings all the time where someone seemingly very smart, much smarter than me, that's not hard to do, comes up to me and says, you know, I think this is so amazing, this HSA, that I'm going to stop doing the 401k and throw all my money into the HSA. And I'll say, what, did you not hear us? Did you not listen? That's not what we're after here. Okay, you don't have to suck up to the HSA guy. You don't have to do that. I'm just telling you right now, you have to use both in tandem. 20 years ago, 20, 30, when we used to say to each other, health and wealth, do you know what we really meant then? We meant stay healthy to spend your wealth. That's really what we meant. Today, health and wealth, in my mind, in my point of view, and in Marge's, is you need to specifically accumulate for health issues, and you need to specifically accumulate for wealth issues. And that's why the HSA and the 401k really are the optimal combination for a health and wealth strategy. And as HSAs continue to grow and proliferate at your organizations, in years 3, 4, 5, 6, 7, this discussion will be very key. Remember 401k when it first came out? You all look too young to remember, so let me remind you. In 1978, the 401k came out, and from 78 to 88, it was very maligned. It really was. And you know why? I'll remind you why. Because back prior to 401ks, what was the retirement instrument? Anyone know? Defined benefit pension, and defined benefit meant stay with us 10 years, you'll make this, 20 years this, 30 years this, right? We're in the day and age where staying somewhere that long is almost impossible. And when 401ks were first launched, basically the employee population said, be careful, this is their way of weaning us off the pension. Similar things happening with high deductible health plans where they're saying, hey, be careful, this is the beginning of the end of our great benefits. I contend that if they pivot mentally and see this as more than just a medical spending account, that actually gets diffused, and not just a little. And 401k, when it changed, when it became more beloved, is when the beloved match came, right? The match showed up and everyone's like, you know, this isn't all that bad actually. Oh, we're at 6%? This is actually not bad at all. Then, 7 years after the match was QDIA, Qualified Default Investment Alternative, where just by signing up as an employee, I'm now in the 401k. I have to opt out if I don't want to be in. Those little nudges are the same things that we managed to learn and engage with PwC over. And so that last slide please. We're gonna end where we began, which is to say, this really now, in my mind, is the definition in our industry of what it means to optimize an HSA. Granted, someone who just feels a debit card swipe is enough for them, that's fine. But let's not keep people in the spender experience by force. Laying a path for them to be able to move up this continuum is really important. I'm done. Q&A. Any questions?
What's the minimum balance required in order to invest? Do you have one for the HSA?
Yeah, excellent question. What is the minimum balance required? It's typically $1,000. Now, I'll let you know that there are some employer groups that want it less than $1,000. We do allow, larger employers to engage us effectively about what it ought to be, but industry-wide, you're seeing it move down. I very recently came across a company whose minimum investment was $3,500. And if you think about HSAs, that's the same as saying no one here is going to invest. So you do need to get it in a reachable place. Question?
Politically, how tenuous is the HSA? I mean, has it ever come up? I know you work for the company and seems, quite involved. But I know at Citi it's come up. Could HSAs go away?
Yeah, I have one of you in every audience, and I share your curmudgeonly disbelief in the government's ability to support something wonderful. I'm with you. No, I'm with you. Let's have dinner tonight, you and I. We could talk for hours, okay? Yeah. Here's my response to that. The 401k had a very similar threat. And you know what negated the threat was broad adoption. I mean, eventually, the government didn't have the willpower to take something that was so broadly held. So I hear what you're saying. I mean, I think across the country, if you have a high deductible health plan, numbers are around 6 or 7% adoption of employee population. I don't think it can stay at 6 or 7 and not have this issue looming out in the future of whether will all these wonderful tax advantages get taken away. By the same token, this seems to be moving in lockstep with where we're trying to go, which is to share the costs. So I know I didn't even answer your question because I'm trying to stay positive. Next question.
Just one thing I'd like to add to that. In our organization, we basically said it may go away sometime in the future, but get it now while the getting's good.
Oh, there you go. There you go. Yep. Make hay while there's hay to make. Yep.
You mentioned automatic enrollment for 401k. Have you seen automatic enrollment for HSA?
So there is an equivalent where it can be set up so that once someone says, I want to be in a high deductible health plan, we certainly have the capability where an HSA is immediately created.
We do that.
Yeah, and PwC does it, and I contend that's a big deal.
So we do that too. We just did a full replacement, so we only have HSA. It's automatically created, but can you do it kind of like for $25, you're automatically enrolled and you have to opt out of your own contribution?
So on our system, you can do what's called automatic investment, where you can pre-set up, even if you have 0 in the HSA, so that it'll kick in and start doing it when you hit whatever thresholds you set. And I agree with you, that's what you should do, right? That's what you should do. Okay. And you're full replace?
Yeah.
Okay, well, let's go to dinner. I believe in you. Yes?
I have a question. I know the average age of both of your companies is on the younger end, but when you're dealing with more mature employees who are being shifted into those high deductible plans, how do you kind of balance out the effects of high utilization? So those employees that have high utilization, they have to spend more now to hit their deductible, and combining the HSA with that, how do you shift your marketing to kind of appeal to those high utilizers?
Our tendency is to really promote this idea of banked benefit. And banked benefit, not everyone has the resources, but banked benefit is, look, go and spend on medical, but don't use this account to do it. Contribute, 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 and then someday in the future, you can use our mobile app or upload it into our portal. You can reimburse yourself from the account, but leverage these years, because there aren't a lot left, right? And don't judge the youthfulness of our company based on my immaturity today. But we're still young, but that's how we do it, is we really focus on banked benefit. One of the things we've been doing is open enrollment for like management and executives. And that sounds contradictory, doesn't it? Because they don't like to show up to that stuff. Well, guess what? You can't name the meeting HSA. You have to name it Triple Tax Strategies for 2016. Then they show up.
Just one other thing that we've done is that we have some claim examples where we talk about at different levels of medical spend. So if you think your healthcare expenses are going to be $5,000 or $10,000 or $50,000, and we run through the costs when you include the premiums, and we've shown people that even at higher levels of spend, that the high deductible plan, because we've worked it out that way, is the most advantageous plan to be in. That you still end up saving, you still end up spending less money when you're in our high deductible plan than you would if you were in our traditional plan, because we're trying to get people to migrate voluntarily.
Have you seen any good techniques, or are there any to incentivize people to invest? Maybe the employer seeds the account more if you invest, or I mean, these numbers are great, but again, trying to, you can bring the horse to the water, but to get him to actually drink.
Well, it helps to bring a thirsty horse. Just begin with that. So the answer is, look, there's no question that seeding, putting money in, remember what happened to 401k? Maligned, and then a match showed up. So there's no question you can lead them down this path by providing incentives. Specific incentives to investing where we say if you invest, you get X, that sort of thing gets dicey. But I know the path you're talking about. And without a question, if you can put all the necessary, at HealthEquity, our HSA, and I discovered 3 years ago that's all we have, remember that? And they actually do matching. They provide the ability to take advantage of these health and wellness, where I get physicals every 6 months and there's $100 that shows up in the account. And so there are, one of the things I can do is if you can come up afterwards, there is information I can provide you about what we have been doing and see what you think.
We do seed, for people who participate in the highest deductible plan, we contribute $750 for single coverage and $1,400 for any level of family coverage, and it goes in pro rata over the course of the year. So that definitely encourages people to at least take a look at the account. Whether or not it gets them to invest, that's a different story.
Yes, please.
Can you talk about the challenges of reprogramming? Because we're just 401k save, and then the complexities of Roth to, 401k, then switching over to your HSA, and then back to 401k. What kind of challenges do you encounter with that?
Well, look, like any challenge, it's about getting the news out there and helping them understand, right? That little slide that Marge went over about, contribute to the 401k up to the match and then whatever's left over, right? We're getting more and more employers saying, will you please focus on that? Now, here's what's kind of funny. Every so often, we engage the 401k record keeper of a company. Because we'd like to do bi-directional single sign-on like we do with PwC, where someone can sign on right into the K and right into the HSA, or see the 401k balance in our portal, which we love to do. And the record keepers at first, the 401k record keepers, would say, we're really not interested. But that was code for, we really don't want your HSA to take any future contributions of our 401k away. And I understand that. We're all in business to stay alive. But employer groups, employers are recognizing this convergence of the two accounts coming together. And so the answer is you have to in some ways create it so that there's an automated way that we can interact with the 401k plan and message in our portal. So just as an example, we do have 401k record keepers we're integrated with, where you'll see a message in the HSA portal that says, hey, you're not contributing up to the match of your 401k. Click here to do that. Remember, in the 401k space, if 15% of the population shows up in the web portal annually, that's elation, right? In our portal, we get 70% that come in annually. 70% annually come into our portal. And I'd love to say it's because the portal's beautiful and easy, and it is, but it's mostly because we have their money, okay? You tend to go where the money is. So I hope this was helpful. Any of you have questions, feel free to come up, but thank you for coming.